So our patient is Cristina Martinez. I'm Natalie Bochos.
I'm Martin Jean Kim.
So about our patient. So we had this 50-year-old female come in. She is Hispanic and she usually maintains a healthy diet and exercise habits. However, she is a smoker. And we found out that she had some precancer cells due to an HPV infection. So as a result, we did treat her with cryosurgery. And after that, we did discover that she had been, we did diagnose her with stage 3 squamous cell carcinoma in the exocervix.
3 years ago, we found a low-grade intraepithelial lesion detected through a Pap test, and low-grade intraepithelial lesions are irregularities in squamous cells, and so these are found in the transformation zone of the cervix, where columnar cells of the lining become squamous cells. The cause of these changes were through repeated HPV infections, and cryosurgery was used to remove this lesion. But now, stage 3 cancer has appeared. So this transition takes about less than a year to happen. The cancer is defined by abnormal cells developing in transformation zones. The most common place that it metastasizes is through the endometrium and the lymph nodes around the pelvis area. Cervix cancer is diagnosed through Pap smear tests, HPV tests, and colonoscopies.
So on the right, you can see two pictures, and the top one is where the exocervix is, so it's right underneath the endocervix. And then below is just what cervical cancer looks like from the inside.
Here's a chart of the progression of cancer into
Cervical
cervical
cancer.
cancer. This is a treatment that was attempted in Cristina. So the 5-year survival rate for stage 3 cervical cancer is about 63%, and usually these are the typical procedures. Surgery, such as hysterectomy, is the total removal of the uterus, and translectomy is the removal of the cervix only. Radiation therapy provides local doses of radiation near the site of the cancer, and chemotherapy uses chemicals to kill fast-growing cells. None of these proved effective for her. Immune checkpoint-based treatment is the experimental treatment here. What immunotherapy does is it utilizes the body's own immune system to fight its cells. The cancer invades the immune system typically through the presence of antigens and inhibitors to tell T and B lymphocytes not to attack the cancer cells. Immune checkpoint inhibitors are a form of naked monoclonal antibodies, and these are antibodies that bind to the receptors of cancer cells and prevent T cells from attaching there, thus eliciting an immune response. So the protein in question is PD-1, and it's on T cells, which binds to PD-L1 receptors on cancer cells, causing cancer not to be attacked. The PD-L1 inhibiting antibodies manufactured using transformation and injected into the blood. At the immune checkpoint, T cells usually bind to various receptors on the cells to make sure that they are part of the body. If the protein is not present in the cell, cytotoxic T cells lyse it. Cancer cells avoid this by carrying PD-1 on their membrane, which binds to PD-L1 cells on T cells. PD-L1 inhibitors prevent this binding and create an increase in T cells in cytotoxic and memory T cells. This is an example of the PD-L1 and PD-1 action where tumor cells avoid the immune checkpoint inhibition. The CTLA targeters are another type of immune checkpoint inhibitors, and they are used in conjunction with PD-1 cells. CTLA-4 antibodies prevent CTLA from binding to T cells, which provides a boost in the immune system. And this is an example of CTLA-4 on
So
tumor
next,
cells.
using this immunotechnology, we created a clinical trial. So our clinical trial will test the safety and efficiency of our immune checkpoint-based treatment for exocervical carcinoma in women of ages 35 to 65 years of age. So background, the population being studied are women who have previously had cervical cancer or cervical in the endocervical areas. People being studied are required to not be treated with any other cancer treatments at the same time. So this would include chemotherapy, radiation therapy, or anything of the sort, just so that way it does not interfere with our study. And women have to be of ages 35 through 65 years old and have acquired HPV through infection and have already previously tried radiation and chemotherapy, and that those things did not work, just as Christina's case. So here you can see how it's going to be administered. So um, so our delivery method is, so the immune checkpoint inhibitors will be administered in the form of naked monoclonal antibodies, and this is produced by melanoma cells fused with B cells. So the PD-1 inhibitors will be injected as the main treatment shown in this picture here. And so the CTLA-4 targeters are also injected to boost the immune system, and the PD-1 inhibitors will attach onto the PD-1 inhibitors on the T cells, which prevents it from binding to PD-L1 markers on the cancer cells. And this will be administered once a week for 4 weeks by a gynecologist.
This treatment will destroy cancer cells by attaching onto T cells, and this automatically identifies the T cells, so it's very specific. When cancer cells are recognized, T cell production is proliferated, and more cytotoxic T cells and memory T cells are produced. Memory T cells now target the cancer cells specifically, and that is how they are
So
targeted.
our risks and benefits, there are many to each side. So before this, it worked for other endometrial cancers. However, this is the first time we are being tested for cervical cancers. So obviously there are some risks and benefits. A lot of the side effects include nausea, fatigue, diarrhea, and it makes you more prone to common colds and flus. And so the benefits of this are the side effects are less severe compared to like other things such as chemotherapy, radiation therapy, and the possibility of survival in the last stages of cancer are like exceedingly higher because it's a fatal part of this cancer, and this research will help other people. Obviously, the T cells may misidentify body cells and attack them, so this is a risk. And the body may also have a severe allergic reaction. The treatment may require a longer time frame than the 4 weeks that we are doing, so we might have not enough time. So the goals include the medical benefits outweigh the risks, and millions can be treated in early to late stages of carcinoma. We want to be able to assess the safety and efficiency of the treatment. We hope to have a new safe method in treating cervical cancer, and we also want to get our medication for IRB and FDA approved and get it on the market. And we want to make this a viable alternative to chemo radiation therapy. Our selection of subjects will include, so our gynecologists will be able to assess their patients, and they will know that if their patients are in stage 3, they can offer this option to them. Obviously, the women have to be aged 35 through 65 years old, and the cervical cancer has to be acquired through HPV, and it also has to be recurrent cancer in which chemotherapy did not work.
So our trial design is a stage 1 trial. It's an orphan drug trial, meaning that there is no control group, and this is because the cancer is so fatal that everybody who's receiving the treatment will see immediate improval of symptoms if it works. It's an open trial, meaning that there's no control group. In the first trial, 80 to 100 people are going to be tested and selected for this treatment.
So, assessment of safety. We want to ensure that our safety for our patients are optimal. So, we want to make sure that our patients can opt out at any time they don't feel comfortable anymore. Patients will also be informed about all possible side effects, and Patients will also be given informed consent, and our doctors value the lives of patients over the study. So if we find that this study becomes unsafe to our patients, we will definitely let our patients know and stop the test right away. And before we are testing it on our patients, the medication has already been tested in vivo and in vitro.